When I wake up in the morning, love, and the sunlight hits my eyes, and something without warning, love, bears heavy on my mind. Oh, then I look at you, and the world is alright with me. Yeah, just one look at you. Oh, and I know it's gonna be a lovely day. A lovely day. When the day that lies ahead of me seems impossible to face, when someone else instead of me always seems to know the way, oh, then I look at you, and the world is alright with me. Yeah, 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 just one look at you, and I know it's gonna be a lovely day. Yeah, yeah. Oh, a lovely day. Yeah, yeah, yeah. Oh, a lovely day. Our day will come, and we'll have everything. We'll share the joy. Being in love can bring. No one can tell me that I'm too young to know. I love you so, and you love me. Oh, our day will come if we just wait a while. No sharing the joy, we'll think love and we'll smile. Our love has magic because we'll always stay in love this way. Oh, our day will come. Oh. Love has magic because we'll always stay in love this way. Oh, our day will come. Oh, our day will come.
Good evening, everyone, and welcome to the Mass League's 2021 Annual Awards Gala in Good Hands. I'm Karen Holmes Ward, Director of Public Affairs and Community Services, and the host and executive producer of Channel 5's weekly magazine program, Cityline. And I've also been the host of the Massachusetts League of Community Health Centers annual gala for almost 25 years now, which means I'm very well acquainted with both the ins and outs of your unique event, and more importantly, the mission and work of community health centers. This year is one for the books, that goes without saying, but what do I need to say? While I have the chance, what I really want to say is thank you. Thank you so much for everything you've done to care for people who really needed you over this last year. Your patients truly were in good hands. And thank you for taking the time tonight to celebrate all of that work and 7 of your outstanding colleagues who reflect the best of everything that you do. As we all well know, there were many transitions this year, including a big one at the Mass League. After 41 years at the helm in January, your fearless and distinguished leader, Jim Hunt, handed the baton, the torch that was on fire, to Michael Curry, who I had the pleasure of introducing next. Michael Curry couldn't have come to his new role as president and CEO of the Mass League under more demanding circumstances in the middle of a pandemic and heading an organization emblematic of health equity in our Commonwealth. But Michael was well prepared for this moment. Before joining the league as its deputy CEO and general counsel in 2008, Michael worked for 16 years at Blue Cross and Blue Shield of Massachusetts and spent most of that time as senior policy advisor in the corporate affairs division. He has served on the healthcare transition teams for former Massachusetts Governor Deval Patrick and former Boston Mayor Marty Walsh, and was involved in the passage of Massachusetts health reform and the Affordable Care Act. Michael is the past president of the Boston branch of the NAACP and has over 20 years of dedicated service to the NAACP at the city, state, and national levels. He sits on the National NAACP Board of Directors and served as chair of the National Board's Advocacy and Policy Committee and as vice chair of the Political Action and Legislation Committee. Over this last year, Michael has played a pivotal role on both the City of Boston's COVID-19 Health Inequities Task Force and the Massachusetts Public Health Association's Task Force on Coronavirus and Equity. His voice has helped to ensure equity in testing, tracing, and vaccinations in the communities, as he often likes to say, that are closest to the virus. Michael continues to be an important and much sought-after voice on health equity and racial justice, challenging all sectors, not just healthcare, to help build a more equitable society for all. Please welcome Michael Curry.
Good evening. Thank you, Karen, both for that introduction and for your award-winning work at Channel 5 to shine a light on the accomplishments, concerns, and issues facing people of color living in Boston and beyond. First, I want to offer my congratulations to this year's awardees. Your service to our patients, to your patients, and the communities are what tonight is all about. We look forward to getting to know each of you a little better through your video tributes, which are coming up soon and are the hallmark of this event. And a huge welcome to all of you who make up the state's largest and hardest working primary care network. You are the true heroes of this pandemic. We will take an important moment later in the program to reflect on the last 15 months in all of its dimensions, from the challenges to the heartbreak, to the exhaustion, and importantly to the victories, so please stay with us. I'd like to take a moment to thank tonight's sponsors for their overwhelming generosity. Our round of applause sponsor, Mass General Brigham. Our hands-on-deck sponsors, Always Health Partners, Community Care Cooperative, Greater Lawrence Family Health Center, and South Boston Community Health Center. And our high five sponsors, Blue Cross and Blue Shield of Massachusetts, Boston Children's Hospital, Boston Medical Center and BMC Health Net Plan, Commonwealth Purchasing Group, Day Health Strategies, Harvard Street Neighborhood Health Center, and the New England College of Optometry and New Health. And thank you to all of our helping hand sponsors, advertisers, and individual supporters as well. The Mass League has long enjoyed the support of incredible partners. This year, that support was unprecedented and came in many forms. I want to extend a special thanks to a group of prominent state and national philanthropic foundations that helped us launch a $4.9 million vaccine and recovery fund for community health centers. They include the Barr Foundation, the Clareman Foundation, Barbara and Amos Hostetter, the Boston Foundation, Liberty Mutual, Combined Jewish Philanthropies, and Trefler Foundation. We are, again, extremely grateful to you. And of course, the tremendous resources that came from our state partners at the Executive Office of Health and Human Services, the COVID-19 Command Center and the Department of Public Health to ensure equitable testing, treatment, tracing, and vaccination for our communities that shoulder the greatest health and financial burdens of this pandemic. Thank you. I would be remiss if I didn't raise up what is the most recent and historic investment in health centers and health equity the state has ever made: the implementation of a new mass health payment methodology and resulting rate increases of a magnitude we have never seen. Under this new methodology, federally qualified health centers will experience an overall 50% increase in their Medicaid rates. That translates into over $100 million in new funding for 33 FQHCs in 2022, and up to $600 million in new funding over the next 5 years. We cannot express enough gratitude to Governor Baker, Secretary Sutters, and Assistant Secretary Dan Tsai for helping us finally achieve the decades-long work to secure financial sustainability for health centers. These unprecedented investments reflect a deep respect for the innovation and honorable work at health centers, and will help us move the needle on health equity like never before. And now I get to introduce one of my favorite people and a tremendous leader in the health center movement, my friend Liz Brown, CEO of the Charles River Community Health in Austin, Brighton, and in Waltham, and the board chair of the Massachusetts League of Community Health Centers. She's my chair. Her dedication to and insights about the needs of both our patients and our workforce have provided a necessary beacon in a year filled with confusion and uncertainty. I am so thankful to have had her by my side as we work to find our way from the earliest and darkest days of the pandemic to the more recent ones that have been focused on getting life-saving vaccines to our hardest hit communities. There is much work left to do on that front and so many others. But I want to thank Liz for her incredible thoughtfulness, work, and devotion to the communities we collectively serve. Thank you. Liz?
Good evening, everyone. I was elected as chair of the Mass League Board of Directors last summer in the midst of the COVID-19 pandemic. I am very thankful and want to acknowledge Sue Joss, the prior board chair, for extending her term while the Mass League and the board figured out how to hold elections virtually, among the hundreds of other things that the League and health centers were pivoting to address during that time. Nearly a year later, and 6 months into vaccinating our staff, patients, and community members, this is a good time to stop and reflect on all that we have been through and accomplished this last year. While the spring of 2020, in my mind, remains scary and the most intense months of the pandemic, as our world was literally changing around us daily, and each health center had to figure out how to best provide care to our patients, I am incredibly proud of how community health centers rose to the occasion and not only met the need, but often went above and beyond to do whatever it took to abide by our mission to serve everyone in the community, regardless of circumstance. Whether it was providing care via telehealth, training dentists to do COVID testing and vaccination, running filled prescriptions out to the parking lot to bring to patients' cars for safe curbside pickup, or increasing our efforts to address rising food insecurity, our boards, managers, and staff have been there day in and day out, always at the ready to address the one constant, which was continued change as we had to address each phase of the pandemic as it unfolded. Like all of us, I certainly did not expect the pandemic to still be such a significant part of our operations, patient care, and daily lives in June of 2021. nor did I think I would be presenting my first Mass League Gala Chairs Award virtually. On the other hand, given what we've all been through over these last 15 months, it took me less than 1 minute to know who I wanted to give this award to. The 2021 Chairs Award goes to Assistant Majority Leader and the State Representative from Alston-Brighton, Michael Moran. Given that both of us are fully vaccinated, I had the pleasure and privilege of presenting Representative Moran with his award personally prior to tonight's event. Good evening, everyone. At the recent Mass League CHI conference a couple of weeks ago, remarks from Michael Curry and several other speakers spoke of the importance of relationships and helping community health centers successfully weather the pandemic. I could not agree more. I have been CEO at Charles River Community Health for 12 years, and Rep Moran has been in office for 16 years, and so we have a long-standing relationship. I am so thankful that he has always been here for me, the health center, our patients, and the community. But during COVID, Rep Moran turned up his efforts to a whole other level. It was so easy to write these remarks because all I had to do was look at the text messages that I've received from Rep Moran since the very beginning of the pandemic, with his constant offer to help. Here are a few highlights. April 14th. Do you need face shields at the health center? Of course we did, given the mess that was the PPE supply chain at the time. I sent him some information, and literally the same day, he sent me photos of 2 face shield options. I let him know which option was better for our clinical staff's needs, and 50 face shields showed up at the health center in the trunk of Rep Moran's car only 2 days later. Only a week later, we received over 50 boxes of fresh produce from a local business that Rep Moran had helped coordinate to address the enormous increase in food insecurity among our patients. The day after that, it was an offer of boxes and boxes of gloves from a local university health services practice that had extra supply because there were no patients on campus at the time. Then it was more PPE when we launched our COVID testing in May. Then during the summer, Rep Moran called me while I was on vacation to let me know he was sponsoring funds for us in the state budget to bring additional resources to Charles River to address COVID, and could I get him a budget the next day to let him know what we could use the funding for. That resulted in very generous funding at an incredibly critical time for our organization so that we could continue to meet patient and community needs. And finally, in January of this year, Rep Moran began sending me names of neighbors in our community who were high risk and needed to be vaccinated as soon as he learned we had vaccine and had begun vaccinating our patients and community members. Words can really not express how grateful I am for Rep Moran's tireless advocacy, support, and presence during this last year to help his local community health center get through a once-in-a-century pandemic. With that, I present the 2021 Chairs Award to Assistant Majority Leader and State Representative Michael Moran. Thank you so much.
Thank you, Liz, and thank you, everybody. I am deeply honored and grateful to receive this 2021 Chairs Award. I would be remiss if I didn't take a moment right now in the beginning of these remarks to thank all of you for your hard work and commitment to your individual neighborhoods and the Commonwealth over the last year in helping us get through this pandemic. You were on the front line, and we simply could not have done this without you. Over the past year, our collective strength as a Commonwealth has been tested in ways that we could never imagine before. And in lots of corners of the state, some of our most vulnerable residents would have been left behind without proper care during this COVID crisis, if it weren't for the 52 community health centers across the Commonwealth and the care that you provided those residents. Thank you, thank you, thank you. I have to be honest. Until I was elected in 2005, I never gave health centers any thought. Probably because I never had to worry about where I was going to receive my healthcare needs. Then I met Liz Brown. The moment I met her, I could see her passion for the Joe Smith Health Center and the people it served. It was infectious, and it made me want to help as much as I possibly could. Over the ensuing 16 years, I truly learned that healthy people lead to healthier communities and better lives. If it wasn't for my health center, I can't say I would ever learn or completely understand that connection. In the next 16 years, Liz and I would work on a lot together. We found a parcel of state land and secured funding to build a new 48,000 square foot state-of-the-art health center. Next at that health center, we opened up a pharmacy. Working with Liz and the people at the health center, we changed the name of the health center from the Joe Smith Community Health Center to the Charles River Community Health Center. And as Liz has referred to in her remarks, we secured funding most recently for testing and vaccinations during this crisis. And we provided food for our residents and our neighbors who struggle with food insecurities. All of this because of a health center, a building in my community. Healthy people mean healthier communities and lead better lives. I want to thank my good friend Liz again, and I want to thank the Massachusetts League of Community Health Centers for this honor.
That's heartfelt. I want to thank my friend, Rep. Moran, longtime friend, who I got to work with over a decade ago on redistricting, and he was a leader on that issue as well. Congratulations. I want to take a quick second just to acknowledge another philanthropic leader who, as we say in the Mass League, has helped us meet the moment in health centers, and I want to thank Bank of America for their tremendous support. The recipient of this year's Public Service Award is truly one of us. Not only because she was the chief medical officer at Boston Healthcare for the Homeless for many years, but because she sees the role of public health as a dynamic and multidimensional one, not solely as a means for addressing epidemics or tracking the course of infectious disease, and at the center of all that is her passion for equity. Dr. Monica Burrell, who served for 6 years as the Commissioner of Public Health in the Baker-Polito administration, led the response to some of the most vexing public health issues of our times: the opioid crisis, vaping-associated lung disease, Eastern equine encephalitis, and the COVID-19 pandemic. Through it all, she maintained her broad view of public health, including framing gun violence as a public health crisis early in her tenure. Monica's approach to the opioid crisis epidemic was also innovative, encompassing awareness, prevention, intervention, treatment, and recovery. She reached across disciplines in this work to develop the nation's first opioid core competencies program to educate doctors, nurses, dentists, and behavioral health professionals about how to address the health needs of people struggling with opioid use disorders. And the prescription drug monitoring program she helped launch in 2016 helped to reduce opioid prescriptions by 45% across the Commonwealth. Under her leadership, our state's childhood vaccination rate has been the highest in the country since 2019. And Massachusetts became the first state in the nation to control access to vaping products and tobacco flavor. We all know that she was at the forefront of the state's management of the pandemic and held the state's feet to the fire when it came to equity and arming community health centers with the PPE, testing swabs, and vaccinations we needed to address our pandemic-ravaged communities. Monica, please accept this year's Massachusetts League of Community Health Centers Public Service Award. We are so grateful to you, and know that wherever you land next, you'll be close in thought, vision, and mission.
Hello, I can't tell you how much it means to me to be honored by you, my colleagues and friends from the Community Health Center world. It's an honor to be considered among so many amazing leaders who have risen to the occasion to fight this greatest pandemic of our lifetime. In my 6.5 years at the Department of Public Health, we have framed our work based on a precision public health model. My guiding principle has always been to use the data that we collect to better understand the social determinants of health and use those findings to elevate and address the health disparities that so many of our patients are impacted by. This approach has underscored that certain populations have a heightened burden of illness regardless of the disease. These populations include our communities of color, individuals with a history of incarceration, individuals with a history of homelessness or housing instability, individuals who have a history of substance disorder, and individuals with mental health issues. We have used our data to focus on individuals such as those I just mentioned to really focus on where our services are most needed. This approach has shifted the lens through which we view our public health work, centering on health equity. This framework has also been used for our racial equity work, including our racial equity data roadmap and improvements in our ability to capture and analyze data on demographics, including race and ethnicity. This framework also shaped the foundation for our equity-centered approach to the COVID-19 pandemic, a pandemic which has put a harsh spotlight on existing health inequities, the inequities that we know and see in our health centers every day. Our partnership and work with community health centers has been integral to addressing the health inequities during the pandemic and beyond. You have raised the voices of your patients and helped define how to best provide access to testing, treatment, and vaccines. This has been critical in ensuring that those most vulnerable, the people you and I care so deeply about, have access to life-saving resources. I've been admiring your frontline dedication to our patients during the pandemic, and your information by raising our patients' voices has really allowed us to shape policies and programs that can directly improve the care of our patients. As I depart from the Department of Public Health, I know that the collaboration with community health centers will continue to play a pivotal role in how we continue to provide critical services across the Commonwealth. Thank you again for choosing me as the recipient of the 2021 Public Service Award. I wish all continued good health and fortitude as we push forward with this important work. Thank you.
This was a year of loss for so many. And for healthcare organizations like ours, the grief was twofold. We lost both patients and colleagues at a time when those colleagues and patients felt more like family than they ever had. Please let's take a moment to remember our health center family members who will be forever tied to our timeless mission.
as we continue to navigate the evolving needs of our COVID-19 ravaged communities. For me, there is one thing that keeps emerging over and over. Health centers were made for this moment. Back in 1965, when the first health centers were founded in Massachusetts and Mississippi, the vision was about equity. Equity in healthcare access and delivery, in economic and educational opportunity, and in the ability of communities to increase their capacity for self-determination. That vision was not only about the particular circumstances of those times, but about the future. Your actions over the last year have been a testament to that vision and helped make the ultimate difference. You save lives. With every testing swab, contact trace, telehealth visit, and shot in the arm, you save lives. You save lives in the communities that many forgot about until our rising voices brought more attention, resources, and conscious raising necessary for effecting the kind of lasting change that is the legacy of this movement. Please join me in watching a tribute to our health center heroes of the pandemic.
Governor Charlie Baker declaring Massachusetts now under a state of emergency because of the highly contagious coronavirus.
Health centers are projected to lose more than $100 million over the next 12 weeks alone.
Last week, we announced that we had expanded our testing partnership with Quest Diagnostics and 18 community health centers throughout the Commonwealth.
In the early weeks of this public health crisis, community health centers across Massachusetts acted rapidly, redesigning our sites and our work to meet the need of the moment.
The state expects to receive between 20,000 and 60,000 doses of the vaccine in the first phase.
Our patients trust us, and it is that trust joined with our experience and expertise that makes us uniquely qualified to get these vaccines to the people who need it most.
There are a lot of people on the front lines of the COVID-19 fight, including healthcare workers who put themselves at risk when we need them the most.
Some of our most crucial partners in the fight against COVID-19 have been the folks who work and manage our community health centers here in Massachusetts.
Thank you for all that you do. It is both incredible and difficult to see those images and hear those voices reminding us of how overwhelmed we all were in those early days, weeks and months. But it also instills a sense of pride and hope about how health centers sprang into action to meet the moment and save lives. The Mass League provides a wide range of technical assistance to these amazing organizations that include clinical programming, workforce training and recruitment of physicians and other clinical roles to health centers. If you are able, we would so appreciate any donation you could make, large or small, to support those efforts. There are 3 different ways to give. The first is by using the Donate Now button on your website, www.massleague.org. The second is by mailing a check to our Boston address at the Massachusetts League of Community Health Centers, MLCHC, 40 Court Street, 10th floor, Boston, Mass. 02108. And third, if you have a PayPal account, use your phone to scan the QR code on your screen. And again, we want to thank you so very much. We're going to take a short break right now and listen to the beautiful sounds of Lydia Harrell and her Side Pocket Orchestra. So please go freshen your drink, enjoy your dinner, and relax with friends. We will be right back in about 6 minutes.
You just never know what could happen tomorrow. Pull yourself together, let go of all that sorrow. Who's coming with me? Who's coming with me? Don't be scared, step right up. If it's half empty, come and fill your cup. For who's coming with me? We gotta stop and think about what we're doing, but don't think too long. Got to get busy and start this schooling. Whoa, who's coming with me? Ooh, who's coming with me? Ooh, I can see light under the door. Ain't nothing stopping me no more. Who's coming with me? We may feel as if we're lost and all alone, but sometimes you gotta stop playing with your smartphone. Don't let anyone or anything stop you from your dreams. Are you coming with me? Woo! I said, I said, you just never know what could happen tomorrow. Put yourself together, let go of all that sorrow. Whoa, who's coming with me? Ooh, who's coming with me? Don't you ever stop. Let's go, we're going straight to the top. Who's coming with me? Are you coming, coming with me? Are you coming, coming with me? Whoa, are you coming, coming with me? Are you coming, coming with me? I give him everything. That's all I do. And if you saw my love, you'd love him too. And I love him. He gives me everything, and tenderly the kiss my lover brings, he brings to me, and I love him. A love like ours could never ever die, as long as I have you near me. Bright are the stars that shine, dark is the night. I know this love of ours could never ever die, and I love him.
Nice music. Well, Jim, here we are together at your last gala, and I am going to miss you. I got to tell you, it's been quite a ride, and what a year to go out in, huh?
For sure, Karen. And it was great memories all the way, and I'll take them to whatever the next chapter brings for me. But maybe it's time for us to take a little bit of a look back.
Lots of stuff going on. Genuine celebration tonight of the people that make community health centers such incredible places to get care and to do work. Plus, remember all those guest stars that you got for those tapes?
Alistair Cook, and Gene Shalit, and Leonard Nimoy, William Shatner, Julia Child, and who could forget the Hood Milkman? The Hood Milkman. That was a blast. Let's take a look back.
Let's take a look.
Hello, this is Julia Child. Hi, I'm Gene Shalit.
I am the great and powerful Wizard of Oz.
Hello, I'm back. Revolutionizing healthcare in the United States.
Secret agent, your mission if you choose to accept it.
Got your good health. Have a great day.
Thank you.
Massleek is the place for me.
Sorry.
Sorry.
Innovative programs that have gained worldwide recognition. Really.
A little tip for you cooks. Improvise.
We sat in traffic all day at the old ball game. Hats off to you, Henry.
This recording will self-destruct in 10 seconds. Good luck.
I don't know, Jim. I think the Hood Milkman was probably the best one. And close, Julia Child, close second. So we're back, everybody. We're ready for the best part of the night, the award videos. First up, our 2 Outstanding Clinician Awards. This award is given to an individual who's demonstrated consistent support of and devotion to the delivery of community health care services through his or her clinical practice. In no particular order, here is Outstanding Clinician number 1.
Hi, Dr. O. I've got some notes of gratitude for all of your time at DMIC and notes of congratulations for your award.
Thank you.
You're welcome.
Dear Holly, you know, it seems like just yesterday we met, but I'm actually reminded that it was more than 25 years ago. I still remember you in the NICU and the way you really cared for not only the babies, but the way you also cared for the staff. Still remember you asking me on some of those days, hey, Dr. Anderson, how are you doing? And those are the types of things that allow me to know that we're always in good hands with you, Holly. All the best, Charles Anderson.
Dear Holly, you've been with Katrina and Willie for over 20 years here at the DMIC Center. I want to share with you something which I think you know. For years, whenever someone asked Willie, what do you want to do when you grow up? He's always said, I want to help people. And then when they say how, he says, I want to be a doctor.
Hi, how are you?
You are the type of doctor that I would be so proud if my son would end up being.
I can hear you. We're going to do that. Yes, you did a great job.
So on behalf of my family and everybody, I want to say thank you so very much. Take care, Mike.
Hi, Dr. O. Do you remember the time when we were having a board meeting talking about the vaccination for COVID and you called the research sexy? I thought that was so funny and it stuck in my mind. Not only were you able to ease our fears and tensions as board members, it allowed me to go back to my community, share that story of sexy vaccinations, sexy research, and the importance of us getting vaccinated. Congratulations, Aisha.
Hi, Holly. I'm trying to sum up what I want to say about you in a few short words. One is mentor. You have been such an amazing mentor to new people coming in, physicians, nurses, people in all other areas of the health center. People that you have mentored end up being such marvelous co-workers. Now for the not-so-good thing. I remember all the plants I've given you over the years, and I remember how each one of them died a miserable death within a few short days. So I have some advice for you. Try growing a Zen garden. Don't worry, it's all sand and rocks and fake trees, so I think you'll do well with that. Love you, Holly. Nandini.
Dear Holly, you have shaped DMIC into who we are today, and for that I thank you. When the pandemic began, I looked to you for strength, even though the exhaustion behind your mask was quite evident. It has been a true honor working with you. Congratulations on your well-deserved award. Love, Marisol.
I'd like to just express my thanks. It is quite an honor to receive this award. And really my gratitude goes to, first of all, DMIC Community Health Center. It's been a wonderful place to call a professional home, and I've learned so much from staff and colleagues over the years. Had a wonderful journey with my patients and families, and I thank you all for the many years of learning, of compassion, of love, and it really is a huge honor for me to be given this award this year. I also want to say a quick thank you to the Mass League of Community Health Centers. They really have been a huge support for me as an individual, as a professional, and for us community health centers. It's great to be in partnership with you. Thank you.
And now, Karen, back to you.
Okay, Jim, next we're going to meet our outstanding clinician.
Good to see you, Donna. How are things?
Sore.
Okay, so the leg is still rough. We all have the common theme within our lives of suffering, and this is what I have come to relieve. And this is the goal of my work. Did you get the lidocaine patches?
No.
She didn't get this. Are they still open? Yeah.
That's us, yeah.
If you can call them. I find it's a way to give myself meaning in life. This has been the focus of my pursuit of medicine and the reason why I went into medicine. Does that seem to be working well for you?
Yeah, it does.
Vince Waite will get in our mobile van and go into communities and go where the homeless are and tirelessly advocating for that population, serving that population. He devotes his life to that population.
We deal primarily with the population that has what we call dual diagnosis, drug addiction and significant mental health disease. So these are the most vulnerable people in our population. We provide them to the access to care. Yeah, you have a good day.
Working with Dr. Wade
really kind of opened my eyes to realizing that being a doctor can allow you to be an agent for social change.
I think we are each called by life to develop our own meaning. Life asks us this question, and the answer lies in a life that's lived in service to others, guided by right conduct, by right action, and informed by love. So this is the thing I model, but I can only be a guide.
It's inspired me to go on and work with the homeless, and I probably wouldn't have done that if it wasn't for him.
Her lung exam, she does sound very congested, and I think that he's made a big impact in the way I attend to patients in the room, and I think that has definitely had a lasting impact on me in the way I practice medicine.
So, shall we go and look at the patient?
Yeah.
He's a remarkable resource and a wonderful teammate whose door is always open.
Can I bother you for a minute? I've gone to him many times with medical questions because of his long history in the medical field, especially overseas in the jobs that he's had.
Ghana seemed to be the place that I needed to go, and spent 15 years there. I was involved in every aspect of the care. It was the time of my life. And I felt part of the community once I learned the language and the culture. There's a Ghanaian concept where there's no true word for thank you, because everybody has a role in the community, and this was enlightening to me. And I get the privilege to go back now with the residents from Lawrence.
They always know that they can rely on him to come, and he provides the doctors who work there full-time with a break. And he does special procedures that no one else there does, and so patients will get on a list and they wait for him to come there, which is pretty incredible.
Hi, Dan. How are things?
Pretty good. Vince is, in his dedication, in his soul, he really exists to be there for people.
A lot of patients who don't usually feel comfortable talking to doctors, they really feel comfortable with him.
Dr. Wade is like the definition of a family doctor who's there to serve their community, and he kind of sets the example for everybody here.
He serves as an inspiration to all of us. He's as good a clinician as I've ever seen, and he's as good a man, maybe the best man I think I've ever known.
Elbow bump, and you take it easy. Receiving this award is incredibly satisfying, and I'm not quite sure how I come to deserve it out of all the physicians within federally qualified health centers in Massachusetts, but it states in a public way that my life and work has meaning, and that's a significant thing for me, as I have just passed 70 years old and have been on the field for this long. It is, one could say, the capstone of my career. And I assure you that my career's not yet over. I still have time left on the clock. But I also want to accept the award on behalf of the many unrecognized physicians who labor day in and day out with their hearts, minds, and soul amongst the resource poor. I have to acknowledge them because any of them could be sitting in my seat today.
Now for award number 3, the Joseph M. Smith Consumer Award honors a community health center board member who exemplifies dedication both to the delivery of primary health care services and the communities in which those services are provided.
Want to give us a short little PCA report?
This is a presentation of South Boston Health News.
Does this thing work?
Brady has been on the board since 2001. She's been president for 9 years. Are there any plans to retire her?
I'm not going to comment on Ann's future.
Coach, beyond the health center, Brady has volunteered for a number of efforts. Christmas in the City, the South Boston Seaport Catholic Collaborative, the Good Samaritan Ministry. She even lectures at St. Monica's and St. Peter's.
Is that a question or is it a sermon, Father?
Do you think it's time for a little free agency so Brady can share more of her time with other organizations?
I think I already answered that question.
Coach, Anne has supported the health center through her many years here. She's helped with the expansion efforts. She's volunteered. She has helped us with the COVID vaccinations. Don't you think that Brady is the GOAT of all board presidents?
You know, it's a total team effort here. It's a total team effort. So I don't like to comment on individual performance.
Coach, over here, Coach.
I'm going to flip this to Tommy. It's a little deflated there, Brady.
Good afternoon, everybody.
Brady, over here, Brady.
Kim.
Brady, where do you get your inspiration to be the best?
Well, my inspiration to be the best on the South Boston Community Health Center board came initially from my friends Jim and Jean Hunt, who really inspired me to join the board. And since then, I've had wonderful mentors. They all helped me learn how to do the chairmanship of the board.
Brady, over here. Brady.
Karen.
Brady, you're a team leader and a team player. What are your go-to resources to develop your skills?
All the folks that work here help me to understand what's going on at the health center. We have a great team here, and everyone communicates well, so we always know where we stand.
Brady.
Nisha?
Brady, can you talk a little bit about your experience here at the South Boston Community Health Center?
First of all, my experience here starts with my practitioner, Dr. Sarah Sloan, who's my primary care physician, and I just adore all the staff. They just make being the board chair easy.
Brady.
Susan.
Thanks, Brady. Can you give us your final thoughts on what it's like to receive this prestigious award tonight?
I'm truly humbled by this award. It comes from a wonderful organization, the Mass League of Community Health Centers. But most of all, I'm so proud of being a part of the South Boston Community Health Center. The board is wonderful, people participate, the health center takes exceptional care of all its patients, but it also cares for the whole community and each other. It's a wonderful, wonderful organization, and I'm very proud to be a part of it.
Brady, over here.
That's it for today. Thanks so much, everyone, for coming.
Congratulations, Anne.
This has been a presentation of South Boston Health News.
The Outstanding Health Center Director Award was established for the purpose of recognizing a remarkable leader who, as the director of a health center, has made a considerable contribution to the community health center network.
I'm Tanya Barber. I went from switchboard operator to assistant front office supervisor, and then front office operations manager, chief operations officer, vice president of operations, and then to president and CEO.
Tanya is transformational.
There's a scripture in the Bible that says, whatever you find your hands to do, do it. And I felt like there was an opportunity for me to lend a helping hand to my team members. And in doing so, I didn't realize that it was going to open the opportunity for me to grow within the organization, because I learned every job in the front desk, helping the team.
Tanya is empowering. She just thinks about things that often I don't see in many leaders in terms of how they empower their staff and their community, and is always willing to help. She believes that what she's gained, she wants to pass it on, and hopefully it will help the next person and the next family and the next community. And that to me is such a testament to her ability to not only be empowering, but to be someone of character who's willing to give more and more the more she receives.
One of the things I love about Tanya is that she finds ways to use people's passions, and she pulls those out and plugs them into the organization's larger vision and initiatives.
Tanya is a motivator.
Tanya has walked the journey that her employees have. She cares about the employee on a personal level and on a professional level. Tanya wants everyone to grow, so she models the behaviors.
For individuals that we bring here into Caring Health Center, most of them, they come in front entry positions, and then I encourage them to further whatever your aspirations and dreams are. I try to encourage them to pursue that, and not only encourage them to pursue that, but then I allow the flexibility so that they are able to do that, and making sure that I'm able to be there and lend a helping hand.
Thanks for the hard work, guys.
Tanya is an innovator.
Tanya to me is kind of the definition of an innovator, and the things that Tanya has supported at Caring Health Center and in her leadership in community health have led to Caring Health Center being leaders in things like having one of the largest health navigator teams, having one of the largest community health worker teams, integrated healthcare, integrating behavioral health at Caring Health Center, doing it in a way that it's meant to address cultural and linguistic needs of the community. She's gotten behind the concept of sustaining long-term research at the health center, which is hugely innovative.
Tanya is an advocate.
I know Tanya for 23 years. There was a line that she always said, trust yourself, believe in yourself, and have faith. She showed me how to be a leader for the community, the patients, in everything that she did.
In a million years, I would have never, ever imagined that I would be seated where I am today as a president of Caring Health Center. When I look over my life, I'm humble, and I never forget where I come from. And the fact that when I look at like my family, when I look at our community, when I look at the struggles, I can't forget where I came from, and my job is to help bring people along, to leave nobody behind if possible, but to help people aspire and achieve their dreams in whatever it is that they feel that they want to do. So I'm excited at this opportunity, and I'm thankful to have been selected to receive this award. I'm humble, grateful, and thankful. And I'm truly thankful to the Mass League and to the team who selected me to receive this award. And most importantly, I'm thankful to my staff who nominated me. I had no idea that they were submitting this application through for the award. So I'm really thankful for my team because, again, without them, it is impossible for me to do what I do collectively together. It's just an amazing opportunity for me to work with such great people. So again, this award, I cannot accept this award or receive this award without thanking the team because they're the ones who make things happen here at the organization. So again, thank you. I'm humbled, grateful, and honored. Thank you again for the award.
This year's nominations for Outstanding Employee were many, but only 2 can make the cut. Those chosen in this category most consistently demonstrate professional excellence, commitment, and caring, all of which are representative of the Community Health Center network and its delivery of healthcare services.
I'm responsible for the health center's environment of care. I oversee housekeeping, public safety, hazardous materials, medical equipment management. I've trained well over 100 staff in crisis prevention, intervention, and certified them. I'm responsible for the overall comfort and safety of our patients. No day is ever the same. It's just a new adventure every day.
Oh, hey, Mike.
Hey, Sam.
I just stopped by to congratulate you on your Outstanding Health Center Employee Award.
Thank you, Sam.
Congratulations. So it looks like you could really use some R&R now that you're getting your award. Sit back, man, relax. Here you go.
Thank you.
Great guy. I've never seen him have a bad day. He just goes with the flow. Whatever needs to be done, he'll just jump right in there.
Time and time again, Mike is able to identify what needs to happen in order to support the organization. It's as though Mike can anticipate before they know what their needs are in order to make that work possible so that we can serve our patients.
Brockton Neighborhood Health Center is in good hands with Mike.
Nancy, have you seen Mike? I want to congratulate him on his award.
Oh, I didn't see him today, but he deserves. He's such a good guy.
Mike has a hand in everything.
Mike has the scope to be in a stakeholder meeting with the mayor, and then also will be a person who, if needed, will change a light bulb and anything else. I think he inspires people to also do what is necessary in order for the organization to do right by our community.
Did you hear that Mike Jackson's being honored as an outstanding health center employee? Makes sense. He always keeps everything in tip-top shape. I know we're in good hands.
By the way, did someone give you the hand sanitizer story? At the beginning of the pandemic, the hand sanitizer turned out to be the thing that we ran out of first. So Mike came up with this idea of turning moonshine into hand sanitizer, and he found a distillery in Rhode Island that made moonshine, and he found a compounding pharmacy in Methuen that would turn it into hand sanitizer, and we didn't have a shortage of hand sanitizer after that.
Mike is the person behind the scenes that is ensuring that all of this is in order for us to be able to create the clinical miracles that happen here every day.
Mike, I can't thank you enough for all that you've done for Brockton Neighborhood Health Center, both before and after the pandemic. You have been tireless in your advocacy to keep our staff and our patients safe. You've put yourself on the line. You come in at all hours. You've had creative ideas to keep us all safe, and I want to thank you from the bottom of my heart for all that you've done.
I'd like to take this opportunity to thank the Mass League and for our administration and my colleagues at Brockton Neighborhood Health Center for nominating me for this award. I'm here in no small part due to all my amazing peers who work with me and who make every working day joyful. I'm humbled and honored by receiving this recognition, and as much as I appreciate this award and as grateful as I am for it, the greatest reward I receive every day is a simple opportunity to play a role in improving the lives of our patients, staff, and those in our community. Thank you.
And outstanding employee number 2.
Vicki has been a force of nature in the organization, both as an institutional memory, somebody who has been here and seen it all, but she also has been an extraordinary advocate, both for her staff and for patients.
Oh, thank
Thank you. Oh, I love this.
Vicki was at the health center for so long that she knew everybody.
I was counting, and you're my 7th CEO.
So many patients knew her by name or would ask for her.
I've watched kids grow up from infants to adults having their own children.
So you were in a moment of transition in your life.
Yeah.
And so you know your past, but the future is always a great unknown. Well, we are bringing in a fortune teller.
Hello, my name is Madame Jaja. I am a seer, a mystic, and I'm going to read your palm today.
Okay.
May I see your right hand, please? You are in good hands. So this is your lifeline. I see 31 years of commitment to the Hilltown Community Health Centers.
That's amazing.
See this line here that curves around your thumb? I see the highest quality of care for your patients. And this long line here across your palm, I see calm under pressure.
Amazing. Vicki had a great talent for taking a situation. She would summarize what needed to get done. You do this, you do that, and we'll get through the day.
Whenever we needed leadership in an emergency, all eyes would go to her.
I see hard work and expertise.
She is incredibly warm, but very strong and very clear. You're talking to somebody who has the right information and can really help solve that problem.
This line is very telling. I see long hours of selfless giving to others.
If we were short-staffed, she would come in on days off, work on a weekend. She would put extra time in to take care of the patients.
I see your compassion for your patients and your staff.
She calls us her kids, which is a really comforting feeling.
She gives you advice if you need it, or she just gives you a hug if you need it.
Nobody gives better hugs than Vicki. I think I could come to her with any kind of circumstance. She's been my rock.
That's quite a palm. You have a beautiful history here.
Very good.
And now I'd like to look into the future.
Given Vicki's incredible strength and dedication, I can't imagine that there's anything that she won't be able to accomplish in retirement.
I see amazing things in your future. I need to invoke the spirits to see deep into your future. I see that you're going to continue to ascend to great heights.
I could imagine her taking the plunge into something new, just diving into something completely different.
Great altitudes. And I see laundry and dishes. You have a lot to look forward to.
She's always going to be a nurse. I hope it's somewhere adventuresome and fun, but even if it's in her little community or even if it's with her church, they'll all know who she is, and that's where her soul is. It's in taking care of people.
This is really something.
Thank you. I'm very honored and humbled to receive this award, and I accept it on behalf of myself, but also all those that I've worked with throughout the years. Thank you.
Our Senator Kennedy was unrivaled in his efforts to expand and support America's community health centers over their long history, a passion that was sparked by his visit to Columbia Point, Dorchester in 1966. In deep gratitude for the senator's esteemed career and cherished role as the nation's chief congressional advocate of community health centers, in 2010, the Mass League created an annual award in his memory. The Senator Edward M. Kennedy Founder Award honors the achievements made by dedicated patients, clinicians, administrators, and leaders who continue to protect and promote health care as a right for all, rather than a privilege for a few.
The Edward M. Kennedy Founders Award is presented in honor of the achievements made by dedicated leaders who continue to protect and promote accessible and affordable health care for all.
We are so pleased that Jay has been selected to receive the Edward M. Kennedy Founders Award.
This award truly represents Jay's 50-year career in public health, over which half has been with the Holyoke Health Center.
Having been at the helm of the Holyoke Health Center since 1994, Jay has proven himself to be a compassionate leader and has guided the Holyoke Health Center into the 21st century.
You may or may not know, this used to be a furniture store, and it was Jay's vision that he could see the possibilities. And that's really how Jay approaches the world. He sees the possibilities where other people may not.
So Jay, welcome to our new space. We've been able to really do so much more in this area. We're able to serve so many more patients. It's been going really well.
The opioid epidemic has hit our community very hard. Jay, he knew exactly what to do, and he went out and procured everything that we needed to be able to have the resources to have now a state-of-the-art Center for Recovery Services in which we can provide all of the services under one roof. For the past 50 years that is dedicated to healthcare, dental services, and particularly dental care for children, has been one of his priorities.
We started a very small dental program when I came. We now have, 20 dentists plus upstairs full-time. We're training pediatric dentists and family dentists. And so the pediatric program has become significant. We really are the safety net for most low-income children in Western Mass who need significant dental work. They wind up coming to us.
The pharmacy program here at the health center is nationally known. They continue to be really innovative and understand the needs of the patients at the health center.
It's been really busy here right through COVID, so.
The robot's doing its job?
Oh, yeah.
We saw opportunities in pharmacy just to keep growing it and expanding it and improving it and integrating it in the medical world in a way that most health centers don't integrate.
Probably gonna have to add a few more drivers.
You know what? Too bad we didn't have delivery when we had the Hurricane Maria event. We could have just delivered things right to Puerto Rico.
That would have been great.
When Hurricane Maria hit, that was the first time I realized how Jay was dedicated to helping the people in Puerto Rico.
Jay went down to Puerto Rico to bring supplies.
He was dedicated night and day to look for any resources available to be able to bring to the island. Jay had this undying desire to be there and help.
Hi Jay, our warmest congratulations from Puerto Rico on receiving the Edward M. Kennedy Founders Award. Your leadership demonstrates your dedication towards the healthcare needs of our communities.
We would like to stand out on your collective response to our needs during Hurricane Maria devastation to our island 2017. I still remember Jay waiting at the airport and you handing over boxes of supplies, including medicines and water filtration system. We will never forget your support.
That was probably one of the first times that I actually was in awe as to how Jay really responded to such a powerful disaster.
We realized immediately, the hurricane was still blowing, that those are our people down there. They're connected to us, to our patients, to our staff. We've got to jump in and say, we can help.
I think Jay truly embodies everything that I like about the health center movement. He lifts us all by his example and by his mentorship.
Hi, Jay. I remember when I called you to talk about starting Community Care Cooperative. We didn't have a name yet. And I got about 3 sentences in, and you got it. This is a group of health centers getting together to scale our commonalities to all do better together, and you were a yes. And you've been a yes ever since.
Juan, it's a long day, and I always love coming up to the roof here. It's just a great view of everything.
Yeah, I was looking at the Steiger building, and I realized how many buildings we have developed.
That's right.
From Colombia as asylum seeker, I never thought I was going to be part of something like this.
I'm thrilled to acknowledge Jay on receiving this honor and congratulate him once again from the United States of America.
I'm reminded of the saying that we rise by lifting others. And in Holyoke Health Center, that's what we've been doing over these many years. And as this building has grown up and as these additional buildings have come together, it's everybody's cooperation, collaboration, and support that's allowed us to grow to where we are today. The city of Holyoke and the environment that we serve is in great hands with the staff at the Holyoke Health Center. I'm humbled to receive the Edward M. Kennedy Founders Award from the Mass League of Community Health Centers. I know we can all certainly look to the leadership of Senator Kennedy, who fought a long battle to help us get to where we are today. Whether it was the initial funding for community health centers, the many components of the war on poverty, or even Obamacare, Senator Kennedy's support was critical for the successful outcomes that we see today. One of the most significant issues I dealt with early on in this journey was the onset of the HIV/AIDS epidemic. I found myself searching for ways to help a community cope with the frightening impact of a virus that resulted in unspeakable pain and suffering. HIV had no effective treatments early on, so our staff reached out with compassion, bereavement, and counseling to provide the best care we could at that time. Eventually, a healthcare system found ways to treat the problem, and today, although still a frightening issue, our primary care systems are treating HIV as a chronic disease, allowing patients to live full lives. Fast forward to today, and our work is again defined by a virus, as COVID-19 changed the trajectory of public health, and indeed of the entire world. We have all been doing amazing work to support our local communities in managing and limiting the impact of this frightening virus. We're not out of the woods yet, but public health has educated and vaccinated our population into a certain place of control, allowing additional work to proceed so that we may eventually move away from the impact of this disease. Our collective responses to these outbreaks, however, does not define public health or the work our community health centers do. We do so much more to meet the ongoing healthcare challenges and problems of our patients. Without community health centers, our patients will not have the adequate resources and support to get the routine care and treatment they need. Child health issues, addiction, diabetes, behavioral health, dental problems, and chronic illnesses of all sorts are treated millions of times each day at our many community health centers across this country. Senator Kennedy had many important supporters, and at the state and national level, our own Jim Hunt could be counted on to support the senator's initiatives. At home, Jim was brilliant in demonstrating the support needed so that Senator Kennedy's efforts would be successful. Jim's close relationship with the senator makes this award even more meaningful to all of us in Massachusetts. The senator knew so much about our health centers through his association with Jim. Jim, thank you for your support, mentorship, leadership, and friendship for 40 years or so. I'm proud to receive the EMK Founders Award on behalf of the many men and women I've worked with for this past 50 years. In particular, my local staff that I work with today are nothing but fantastic. I was so proud of the efforts our staff made in response to Hurricane Maria, an event occurring 2,000 miles away, but significantly impacting our local Holyoke community. Staff across the health center helped add evening clinics just to meet the demands of desperate evacuees that were arriving daily from Puerto Rico, invited to the community by friends and relatives in our area who offered their small apartments and homes to their suffering relatives. This past year was another test of the capacity of our staff to change everything in response to the COVID-19 virus. Reconfiguring the building, switching to telehealth, altering staffing patterns to accommodate work from home needs, testing patients in our drive-through system, vaccinating in the building, in local schools, and on our vaccine bus were all parts of our solution. As Senator Kennedy said, the work goes on. I owe a debt of gratitude to all of the generosity and friendships that is evident in our movement. Within this group is a very important subgroup of colleagues I'm actively collaborating with right now in our community care cooperative partnership. It's an exciting opportunity that we have to help shape the future of healthcare. I have no doubt that this group will have much to be proud of in the next few years. A distinction we in the community health center world have is the role of our board of directors. They assure that our community is well served by our efforts, including members representing many facets of our community, especially our patients. The Holyoke Health Center Board of Directors provides invaluable affirmation, and support for the plans and programs we create to serve our community. It's an ongoing pleasure to serve as the CEO of their organization for the past 27 years. Equally important to me is the relationship I have with senior leadership team at the Holyoke Health Center. They are true partners in the work that I am involved with, working daily with each of them to get their views, support, and their efforts to move this program forward. I am amazed as I watch our plans come to life. I am indeed fortunate to be part of all of this. My life, my family, and my career have all been woven together. My wife, Sue, of 49 years, has been there to support me, managing our family of 3 daughters, Jenna, Emily, and Jessie, their partners, and 7 grandchildren, especially when I am busy at work. They are a great motivating force for all I do. I am forever in awe of how they grow and evolve, and I hope I have been able to model some behavior that will always allow them to reach for their dreams and to also help make the world a better place. Once again, I want to thank the Mass League of Community Health Centers for this wonderful recognition of the Edward M. Kennedy Founders Award.
Well, folks, that was absolutely wonderful, and we want to give congratulations to all of our awardees. Well, Jim, it's the end of the gala, and also the end of an era.
Well, then, shall we have the last dance?
Yes, we shall.
Oh, yeah.
Everybody's got a thing, but some don't know how to handle it. Always reaching out.
You mind if I cut in? It's your turn.
Don't you worry about a thing.
Congratulations.
Thank you.
Don't you
Thank
worry
you.
about
Excellent
a
job as
thing.
always.
Work begins, right?
It began last year.
'Cause I'll be standing on the side when you check it out. Oh, you say your style of life's a drag. And that you must
Yeah, I know. Different style.
Just don't you feel too bad.
Demonstrating a different style of dancing.
Smiling faces, but don't you worry about a thing. Don't you worry about a thing, mama.
Facebook.
'Cause I'll be standing on the side when you check it out. When you get off your kick, don't you worry about a thing. Don't you worry about a thing. Oh, ba 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 da 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 wow. Ba 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 ba. Whoa, don't you worry about a thing. Don't you worry about a thing.